Hi everyone, my name is Nate Altland and I'm a Practice Transformation Specialist with Quality Insights. Today I will be discussing some highlights regarding our Hypertension Hiding in Plain Sight module, which was distributed beginning this summer. The slides you are seeing are actual screenshots from pages in the module. You can follow along on the module if you would like. The topics I'm going to address contain information regarding undiagnosed hypertension, how to improve blood pressure control rates within your practice, and resources for your practice and your patients. Please note that our module is full of useful information and this is just an overview. We highly encourage you to view the whole module and click on the links provided so you can appreciate everything it has to offer. The purpose of this module is to provide educational information to healthcare providers to assist in recognizing and addressing undiagnosed hypertension in your patient population. We will provide access to multiple resources and tools that will help you identify these patients and implement process change in your practice. Hypertension is a common and dangerous condition. If left untreated, a patient's risk for heart disease and stroke increases. If a patient has a blood pressure reading of less than 120/80 millimeters of mercury, it is considered normal. A patient between 120/80 and 139/89 is considered to be at risk for hypertension or prehypertensive. A patient whose blood pressure is 140/90 or higher is considered hypertensive. There's a lot of data available in the module on hypertension. Here are a few highlights. Hypertension affects 1 in 3 Americans, or about 75 million people in the United States. Of those with hypertension, about half do not have it under control. Of the 75 million Americans with hypertension, 1 in 5 still do not know that they have it. This means that potentially millions of Americans with uncontrolled hypertension are seen by their clinicians, but the condition remains undiagnosed. Even practices providing the highest level of care can have patients who are hiding in plain sight. These hidden patients are at risk for or have uncontrolled hypertension. Finding these patients and spreading the word about how other healthcare professionals can find them may help save lives. Hypertension costs the nation $48.6 billion annually. This includes healthcare services, prescriptions, and missed days of work. High blood pressure accounts for almost 1,000 deaths each day. That increases the risk for dangerous health conditions such as a person's first heart attack, their first stroke, chronic heart failure, as well as kidney disease. Among the unaware, untreated, and uncontrolled hypertensive population, 81.8% do have health insurance. 82.5% have a usual core source of care, such as your practice, and that 61.7% have received care 2 or more times in the past year. That data suggests that there are potentially millions of people with uncontrolled high blood pressure that are being seen by healthcare professionals, but remain undiagnosed and are hiding in plain sight within clinical settings. We cannot overlook children and adolescents either. It has been found that hypertension and prehypertension were frequently undiagnosed in this pediatric population. So how does your practice go about identifying patients who are hiding in plain sight? There are 4 easy steps that you can take to identify these patients. On this page, there is a link to the 5-minute Million Hearts video, Finding Undiagnosed Hypertensive Patients. This short video goes over 4 key steps to finding patients hiding in plain sight with undiagnosed hypertension. First, establish clinical criteria for potentially undiagnosed hypertension. An example criterion would be patients whose systolic blood pressure is greater than 140 or diastolic pressure is greater than 90 for more than 1 visit in the past year and have no diagnosis of hypertension. Next, you want to search your electronic health record for patients who meet the established clinical criteria. An example would be to run a patient registry report that identifies all patients with an encounter in the past year that had a systolic blood pressure that was greater than 140 or diastolic pressure that was greater than 90. If hypertension was not diagnosed, review the patient record and schedule a follow-up appointment with the patient if indicated. At the time of the office visit, if the blood pressure is elevated, take a few minutes and repeat the measurement. If the second reading is elevated, consider an addition of hypertension to the problem list, appropriate treatment, and a follow-up appointment for a recheck. Finally, you want to calculate your health practices or system's hypertension prevalence. You can compare your data against local and state data using the Million Hearts Hypertensive Prevalence Estimator tool, which you can access through the link right here in our module, shown here on the next slide. Million Hearts has compiled a large online resource library that contains links to a wide variety of articles, case studies, references, and much more related to undiagnosed hypertension. You can access this information through the link we have provided here in the module and shown again on the next slide. The Department of Health and Human Services, HRSA, has provided a detailed overview of the hypertension control quality measure. It has also highlighted some benefits of implementing this measure into your practice. They have provided some specific strategies, which we have listed here to improve your office's hypertension control measure. For more ways you can improve hypertension rates in your practices, please download the Hypertension Control Packet from this location in the module. Noted on this slide is the link to the Million Hearts Hypertension Control Change Packet for clinicians. It contains multiple examples of resources shared by organizations across the nation, such as blood pressure recording logs for patient use on page 9, and an example of a callback workflow that you might consider modifying for use in your practice on page 14. Million Hearts has also put together a consolidated change packet to help map and identify enhancements to workflows around identifying potential undiagnosed hypertension, engaging patients in care, and diagnosing hypertension in a timely and accurate manner. Once you have identified the undiagnosed hypertension patients in your practice, what can you do to improve the blood pressure control rates in your practice? First, you can create a protocol to initiate a standing order that all hypertension patients should receive a home blood pressure monitor. Reinforce the basics with all office staff, such as hosting a lunch and learn with your staff to ensure that they are taking blood pressures using the proper technique. Make sure your staff is following up with a hiding in plain sight patient list. Contact patients to bring them in for a follow-up visit to make sure that the patients are taking their home blood pressure reading. If medication has changed, ask if there are any questions regarding updated dosage. Give the patients a sense of responsibility and accountability by encouraging them to self-manage their blood pressure. You can also offer to calibrate the patient's home blood pressure monitor once a year when they come in for a visit. You want to make sure that the patients have a way to report their home blood pressure reading. You can give them the blood pressure log, or they can communicate the results with you on the EHR patient portal. Finally, staff should train patients on the correct way to take their blood pressure. You can also share the video in this module or play it in the waiting room. The video gives instructions on how the patient should take their home blood pressure to get the best and most accurate results. This video can be accessed at the end of the module, as shown on the next slide. I hope that this glimpse into the important module has been helpful and that you can take some of the information shared and apply it to your practice. As previously stated, this webinar is just the beginning of the wealth of information we have regarding hypertension hiding in plain sight. Please review the entire module and contact your Quality Insights representative with any questions or concerns. We will be happy to assist you in implementing any workflows or suggestions presented in this module. Additionally, our website is available for you to access and download materials. Again, thank you very much for taking time to review this webinar.